is Maria Bujoli, and this week we're going to be doing a neurological examination. The differential diagnostic for this week is going to be MS or pernicious anemia. To begin with, I'm going to start by observing the patient. We're going to be doing some inspection. So I'm going to have my patient stand up for me, and I'm going to have her walk away and then come back for a gait. And then I'm also going to have you work where you step 1 foot in front of the other. Coordination and gait. I'm going to have you take a seat for me. So the next thing we're going to do, let me look at my instruction. Okay, so the next thing we're going to jump into, we're going to do a direct light. For direct light, I'm going to be looking at the ipsilateral eye and going to be putting my light into that eye as well. So I'm going to, okay, and I'll check this one as well. Okay, basically that was direct light, and as I'm printing into the same eyes and I'm observing it as well. For the afferent, it's going to be active nerve 2, which is the ipsilateral eye to light source. And for the efferent is oculomotor and nerve 3, ipsilateral to light source. The next one I'm going to be doing is going to be indirect light. So when I press my light into the ipsilateral or contralateral eye, I'm going to be looking at the opposite, if that makes sense. Okay, so for the indirect indirect light reflex, for the afferent is active nerve 2, which is the ipsilateral light source, and the oculomotor for the efferent nerve 3, contralateral to light source. The integrating center is going to be the midbrain, as well as the integrating center for the direct light is going to be the midbrain as well. You're going to look for the next direction. Okay, so the next test is going to be the accommodation reflex. So I'm going to start. Okay, so the afferent for this one is going to be active nerve 2, and the efferent is going to be oculomotor nerve 3, and the integrating center is going to be occipital cortez. Okay, so basically I was supposed to be observing for the extraocular eye movement right before the accommodation reflex. I'm just going to be looking at the patient, seeing how her eyes are moving. Okay, so the next thing we're gonna do, I'm gonna jump into a jaw jerk reflex. And for the jaw jerk reflex, okay, so for the jaw jerk reflex, I'm gonna be using my reflex hammer, and this feels just like so. Okay, all right. Excuse me. I'm gonna have you open your mouth slightly for me, placing your thumb here, and all right. This was the jaw jerk reflex. The afferent and efferent is gonna be the trigeminal nerve. The integrating center is gonna be the pons. So the next things we're gonna be doing is evaluating the muscle of facial expression. The first thing I'm gonna have my patient do, can you raise your eyeball for me? Okay, can you close your eyes slightly? Okay, can you show your teeth? All right. Can you poof out your cheeks? Can you smile? Can you frown? Again, this was the muscle of facial expression. So next, we're gonna be evaluating for motor function of the soft palate. So I'm gonna have my patient open her mouth and say ah, ah, ah. All right. The next thing we're gonna be doing is going to be, so the next thing we're gonna be doing, we're going to be evaluating for the hypoglossal nerve, which is cranial nerve 12. We're gonna start with inspecting of the patient tongue. So I'm gonna have you stick out your tongue for me, and I'm gonna have you like this. Okay, so if the patient basically if the tongue is protrude out or deviate on one side, there will be unilateral paralysis. So the next thing we're gonna be doing is Fukuda. Okay, so the next test is gonna be the Fukuda step test. So what I'll have the patient do, I'm gonna have her march in place for about 50 seconds with her eyes closed. If I can have you march in place and with your eyes closed. 48, 49, 50. You can relax. Okay, so with that test, a positive will mean if the patient is turning over to one side, which will indicate vestibular lesion on that side of rotation. Okay, so the next thing is gonna be the finger to nose test. So I'm gonna have you take your finger in this hand. I'm gonna have you touch your nose and touch my hand. Get a good pattern going. Now I'm going to have you close your eyes and, okay, let's do that bilaterally. So I'm going to have you get a good pattern going. Now close your eyes. Okay, that's good. So this was the finger to nose test. The next test we're going to be doing is going to be, okay, the next exam is the Huffman reflex. So I'm gonna have you bring your hands out like this and you'll stick out your middle fingers. I'm gonna flick it. All right, this was the Huffman reflex. And the next, all right, so this next exam is the plantar reflex. For the plantar reflex, I've already had my patient lying supine, and this is my reflex hammer. I'm gonna be using the printing end here, which feels just like so, okay? So I'm going to start as I stroke the bottom of your feet. Okay. All right, this was the plantar reflex. And basically the afferent is going to be the tibial nerve as well as the efferent is going to be the tibial nerve as well. And the integrating center is going to be spinal cord, which is S1, S2.